Okay, welcome back to the Diagnostics 3.0 tutorial. This particular tutorial is on the decision tree. Let's see, there's two main tabs here for the decision tree. One is the Diagnostics Decision Tree tab, which is the main part of the program, and the other is something called Category Recommendation. Let's go talk a little bit about the Diagnostics Decision Tree, how it functions, and then we'll talk a little bit about Category Recommendation. Then I'll run a decision tree for you. This is the verbal decision tree. So for those of you who are verbal learners and you like reading and you process information verbally really well, you're going to like this one. The first part of the program has a category selection. This is the thing you do first. So you need to have a general idea where your client's falling or where they could be falling in terms of diagnoses. Now, if you don't know, you can select all, and that's going to give you about 148 questions to go through. But doable if you want to do the whole thing. My recommendation to you would be to try to limit it as much as you can in terms of what categories that you select. So you select the categories and then you click Start, and it runs through questions that you then click yes or no to. You have response considerations that gives you extra hints, extra things to consider when you're answering these questions. And then down here at the bottom, it gives you a progress indication, letting you know how far you've gotten into the decision tree. So how many items you have left and what category it is that you're answering questions in. It's a way to kind of track, to give you a sense of where you're at and how far you got left to go. Based upon how you answer these decision questions, different diagnoses will then be suggested to you in the possible diagnostics or diagnoses section of things to look at in the criteria and the description and the rule outs based upon how you've been answering these questions. So that's kind of how the general function of it works. Let's go back to the beginning though, category selections. If you don't know really what category your client's presenting to you, one way to do that is to go to the category recommendation screen. I've included this because a lot of you wanted to have things symptom based rather than categorically based, and that's hard to do because you're talking about thousands of symptoms, and being able to get you from symptom to diagnosis is very difficult and very time consuming for the user. So what I tried to do was to bridge the gap between symptoms and categories rather than symptoms and diagnoses. I've got a list here of very common symptoms that you find in working with people. And you want to use these rather sparingly and only select the ones that are really, really strongly indicated in your client. That's the best way to use this. So let's say, for example, my client that I'm working with has depressed mood and they have anxiety. And those are the two most prominent symptoms out of all of them. When I click Find Categories, what happens is it goes through the categories to investigate and includes overlapping categories and includes inclusive categories. Basically, these three categories, anxiety disorders, mood disorders, and substance use disorders, based upon these two symptoms are common in these three categories. So it narrows the field down and only selects the categories where there's overlapping symptomology. That's a narrowing. It's a way of kind of focusing in your categories. The inclusive section is more of a comprehensive. You're not narrowing, you're including everything possible. You'll notice the graphic down here, the Venn diagram. These two diagnoses are actually present, or these two symptoms are present in all four of these categories. So cognitive disorders had depressed mood associated with it, but it didn't have anxiety necessarily included with it. So the comprehensive section picks that up. The narrowing part said no, cognitive wasn't, because both of these symptoms weren't present. So if one category is represented by one symptom, it's going to show in the comprehensive, but it's not going to show in the narrowing. So basically, if you want to be really liberal with it, you can get comprehensive. And if you want to be a little more conservative about the categories you investigate, you can click the overlapping. So let's say I want to look at overlapping. So I click overlapping, and it takes me back to the diagnostic decision tree and selects those three categories for me. So again, it's a way to help you determine what categories to investigate. Okay, so let's run through one. I want to clear these out because to run through all three, it's going to take some time, and we don't have time in the tutorial. I'm going to select one that's actually fairly quick to go through, and that's eating disorders. So I select eating disorders. Let's say that's where the symptoms are falling clinically with this client. If I click Start, and the first question is, does the client manifest significant weight loss, or is the maintenance of the client's weight significantly below what is considered normal? There's some response considerations to look at. Some of these patients may engage in behaviors that are manifested in bulimia as well, misuse of laxatives, binge eating, purging, diuretics, and or compulsive exercise. Sometimes you get bulimic behavior in anorexia, and that's what this is kind of shooting for. So let's say that is present in my client's presentation. If I click yes, it actually will pull in the possible diagnoses based upon your response to this and put that in the possible diagnostic decision tree findings. The next question, does the client manifest symptoms that include recurrent episodes of binge eating coupled with self-induced vomiting, misuse of laxatives, compulsive exercise, or other extreme measures to prevent weight gain? And again, there's some more response considerations. So as I consider that and look at that with my client, let's say that doesn't meet what we're looking at. So I say no and nothing's added. And then the last one item remaining, we're about 2/3 of the way through. Does the client manifest symptoms that include significant weight change or abnormal eating behaviors, but does not meet criteria for any of the above eating disorders? Let's say, for the sake of presentation today, we're going to say yes. And now I'm at the end of the DTree items. I don't have any more. I'm 100%, and I've got 2 possible diagnoses based upon my responses to the decision trees. So the decision trees are suggesting potential diagnoses for you to consider. So now I can click on these, or I can click View. And what happens is when I click View, it lists the diagnosis that I just clicked. It gives me the description, the highlighted criteria, and potential rule-outs for that disorder and working with that patient. So it helps me narrow things down, focus on the disorders I need to focus on to do the differential, and then that helps me determine what the diagnosis is. Now I can clear the whole list if I want to start over, or I can delete individual ones, and I can also mark these. So if I want to include those in the marked diagnostics or marked diagnoses section back in criteria and other places, I can mark these here. Now those will be included in the marked diagnoses. If I'm reading through these and I realize, eating disorder NOS just doesn't fit based upon the description, I can delete that one as well. And I'm left with anorexia nervosa. Also, if it's marked, then it'll allow me to use it in the 5-axis diagnosis, which we'll talk about later. So that's pretty much it for the decision tree. Again, it's a simple example because I only use one category, but you can see as you start tracing through possible diagnoses and doing differentials, it really helps you focus in on what the person is potentially dealing with and helps you be a little more comprehensive and careful with the rule outs and the differentials.